Can I invite the UPSM students to say some prayers?
Let's all bow our heads in prayer, please. Om Shri Ganeshaya Namah. Om Shri Ganeshaya Namah. Om Shri Ganeshaya Namah. Om Bhurvaswaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhyo Yona Prachodayat. Om Bhurvaswaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhyo Yona Prachodayat. Om Bhurvaswaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhyo Yona Prachodayat.
من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم.
This is the fourth time that we are all collaborating in such a conference. And Mr. Miles, the collaboration exists across Australia and Fiji in that the Sai organizations in Australia and Fiji have collaborated together with the University, University of Fiji Umanand Prasad School of Medicine and the Fiji College of General Practitioners to bring this conference together. This is an example of Millennium Development Goal 8 in practice, because it is partnerships such as this that make for sustainable development and capacity building, particularly in the health sector in this country. We're indeed honored, sir, that you're here. Please feel free to be with us for as long as you can be, but we appreciate that you might have a busy schedule that requires you to leave earlier. It is now my very great pleasure to invite Professor Mahendra Kumar, who is the Vice Chancellor of this university. Sir, we are indeed honored that you have graced us on this occasion. We look forward to listening to you.
Good morning. Thank you, Dr. Ganeshwar. The Chief Guest, Acting Australian High Commissioner, Mr. Glenn Miles, members of the Sai Medical Unit, Australia, and Sathya Sai Service Organisation of Fiji, members of the Fiji College of General Practitioners, staff, students of Umanand Prasad School of Medicine, ladies and gentlemen. It does give me a great pleasure to welcome you all to this annual conference. This medical event has become an integral part of the calendar for many health professionals and certainly for many staff and students of UPSM. This partnership has endured for the last 5 years or so. Indeed, since the UPSM, our medical school, was conceived, it offers such a great opportunity to our medical students and staff to network and gain valuable knowledge and skills.
Kumar, Vice Chancellor of UPSM, Professor Kasai, Dean UPSM, colleagues, students, guests, and fellow members of the Sai Medical Unit. The subject today is NCD Education and Lifestyle, a holistic approach. The topic given to me is Sai Healthcare and Lifestyle. Sometimes Sai Healthcare is also called Sai Medicare, and High Commissioner will remember the Australian Medicare, which is a very efficient universal health system we have. The approach that I take is that we have to consider man as consisting of body, mind, and spirit. Some people confine their thinking to the body alone, some extend to the mind, and a few would accept spirit. But in a country like Fiji, which is highly religious, there wouldn't be any problem in presenting the subject in this fashion. If I were in another part of the world, there could be some reservations about the idea of a spirit or a soul. I base my presentation as using the foundation of the WHO definition of health as a preamble to their constitution. As you can see here, health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. So there is already a positive attitude towards health, not simply the lack of disease, but something more than that. It took another 50 years for them to come up with this concept of adding on spiritual and social well-being. So spiritual is a very important aspect that we will enlarge on later on with your permission. The Aborigines of Australia also had a similar definition, and you can see that they also talk about cultural well-being of the whole community, and then talk of the whole of life being viewed, including the cyclical concept of life, death, and life. So why health? Is it simply to feel happy and comfortable, or health is needed for something higher? And that we will explore in a short while. The Sai view is that the body is a temple, the mind is an instrument, and realization of the spirit of God within is the goal. This is not peculiar to Hindu thought. As you can see in the Bible, it is said that the kingdom of God is within us. And that's what we mean by the divine spark that is present in all of us. And that needs to be brought out, manifested in our lives as a way of life. And that's the aim of the Sai organization. It is not an organization to spread a particular view. It is a multi-faith organization based on doing service to the community and spreading the idea that all faiths lead to one divinity. So it's an interfaith, unity of faith concept. In taking this path, it is not something that you realize at the end of your lifetime when you're dying or after you're dead. it is something that is realized as the path itself, as the goal during our lifetime. And it is for a harmonious and peaceful world. Swami says, as we all know, prevention is better than cure. But in a light note, once he said, cause of all diseases is due to hurry, worry, and hurry. Hurry meaning food, that we are eating excessively, and we can see that 40% of adults in my own country, Australia, are overweight, and about 25% of children have the problem of being excessive weight. And it is creeping into the Pacific region as well, because the lifestyle has changed, and the accent and stress is on Coca-Cola and bread. You can buy bread in Suva 24 hours a day. You can't buy that even in Australia, unless you go to a supermarket that is sometimes open there. So hurry and worry refer to your mental attitude to life, the stresses, and everybody now suffers from stress. Sorry, the Hippocrates himself said, let food be thy medicine, and let thy medicine be food. So in terms of treating the body, the Sai Organization, Australia and Fiji and New Zealand take part in medical camps and go through into the villages. Just pictures of our activity over the last few years. Over the last 12 years, we have been coming to perform neurosurgical procedures at the Suva Hospital. On 4 occasions, it has been funded by AusAid-related Pacific Island project. The other times, it has been an initiative of the Sai Medical Unit, which was able to get the cooperation of Air Pacific, members of the community here and in Australia, to fund a program by which a surgeon, nurse, and a anesthetist will come with equipment and perform this service. We are at the moment training a neurosurgeon from Fiji in Canberra to become neurosurgeon here. He has finished 2 years, and we are having another year in Sydney. Then we have a neurologist from Suva who has been trained in my hospital in Canberra. We are about to open the way for a radiology registrar from here to come for training for a year. And the ACT government has given scholarships for nurses. At the moment, about 4 are being negotiated to come to Australia for a short training. So this is, as Professor Rajat said, empowerment and training and cooperation, not simply just coming and providing a service and going away. The Sai organization itself in India has 2 major hospitals called super specialty hospitals, which perform 2,000 cardiac procedures each in a year, and more than 1,700 neurosurgical procedures in one of the hospitals. They also have a mobile hospital, 2 vans or buses that carry dental unit, X-ray and ultrasound facilities, and a small operating theatre, and go into villages. Now when you come to body, food is an important part of our enjoyment as much as an essential component of our intake. But when you look at food, we emphasize vegetarian food. Is not compulsory. But if you look at the Seventh-day Adventists, they have one of the lowest incidence of cardiac disease, hypertension, and bowel cancer. So there is something good about vegetarianism, but also it contributes to preservation of the environment in a better way. We don't have to burn the forests of Brazil and to grow grass for the beef that feeds to give you the hamburgers and beef burgers. Preparation and preparer of the food is important. Sarabha says that when you cook food, cook with love and good feelings. That vibration is transferred to the food. Exercise, aerobics, or hatha yoga, which is really the correct term for yoga, which is a misinterpreted word. Yoga means union with God. But hatha yoga is the exercise program that is used to generate this spiritual energy. So the body is a temple, the mind is a tool for a higher purpose. When you look at communicable diseases, the environment is a major factor, external environment. For non-communicable diseases, it is your internal environment. Your mind is a principal agent, which if controlled adequately, you can control obesity, your stress, and various other diseases that are connected with it. So the mind is considered as a key to the internal environment. But where is the mind? As a neurosurgeon, I have not been able to find where the mind is from my readings, Or when I operate, I sometimes look at the brain and ask it, so where is your mind? And we don't get an answer. We know that the building blocks of the mind, the brain, are 100 billion neurons and about 100 trillion synapses that form the neural network. That's the connections between the nerve cells. But is the brain a living computer? The brain has the hardware, but the mind seems to be, to me, in the cyberspace. Nobody can define where cyberspace is. But mind is an abstract thing that has some relevance. All that man has achieved through the ages is because of the mind, not necessarily his body. It's the mind that drives the body towards certain kind of action, so on. But the mind suffers from delusion. The famous delusion, of course, is the mirage. Or when you see the propeller of an airplane, it looks like a disc, though there are spokes that are spinning at a speed. A more important delusion is this, which makes me think that this table is solid. But if you take the atom of the component, the nucleus and the electrons are in between a large space, which in the Hindu philosophy has been described as akas. Now, if you imagine the Colosseum in Italy, or St. Paul's Cathedral, and look at a grain of sand on the floor as the nucleus, the electron will be on the ceiling. So that much is the relative space. So all of us here are largely empty spaces, but we have, for certain physical reasons, the concept or the feeling that we are solid. So, if you reduce the nucleus to just solid condensed particles, we will only be the size of a pill. That's the actual solid component of my body. But there are also other great delusions which lead us to consume alcohol, drugs, kava, consumerism, all that thinking that it gives us pleasure. But look at this dog. This dog is chewing on a dead, dry bone, but is enjoying it thoroughly. Why? Now you can see the blood dripping from the gums of the dog. The dog's gums have been injured, its own blood is dripping into the tongue. The dog enjoys its own blood, but thinks it is coming from the bone. Likewise, we have happiness, joy within us as inherent property, but the external world stimulates it up, and we think that happiness is outside, that happiness is inside. This is what the teachings we come across with Sai Baba. But the mind itself is not very clear to us. Part of it is buried, part of it is submerged as the subconscious mind, which houses the past life experiences, the past experiences of this life, and periodically brings it out as tendencies or vasanas that we describe in the study of the mind. If you're looking at our unique behavior, if you are looking from a secular point of view, genes, family, and environment matter. If you're looking from a spiritual point of view, it's a vasanas or tendencies from past lives, the law of action and reaction, and the company that we keep are important in driving our behavior. So, if it's all in the mind, how can we change and control it for a better lifestyle? You look at what the input is into the mind. They say in computer language, garbage in, garbage out. So, if we put in unwanted information through television, through radio, from the media, and spoil our mind, bad food, and so on, the mind gets corrupted. If you want to neutralize that, take part in a good company, pray if you like, and consider meditation. Meditation is simply not a religious process. It has a beneficial influence on your blood pressure, diabetes, and so on. There has been extensive research done by the Maharishi Foundation and the Dalai Lama's group on the influence of meditation, not only on the physical aspect of life, but also on the brain. So Sai Baba has said that we should watch. Now you all know this character, he likes Rolex watches. Some of us just have simple Casio watches. What's watch to do here? It says mind the watch and watch the mind. And how? W for words, A for action, T for thoughts, C for character, H for heart and feeling. So whenever you watch, look at your watch for time, look at this also as a possibility of guiding principles in our lives. The spiritual component. Many scientists, including Einstein, have been very, very deeply involved in the spiritual aspect of life, creation, and so on. Einstein said spirituality begins where science ends. He also once said God doesn't play dice when he was struggling with the idea of quantum mechanics. Spirituality is simple, Swami says, and everything else is complicated. Everything is spiritual. There's nothing other than spiritual. And our concept is that everything that you see in this creation is simply a projection of God. So if you look at our own evolution and look at the evolution of consciousness, the universe is supposed to be 13.7 billion years. Age of Earth is 4.6 billion. First lives seen about 3.8 billion years. It may have come from Mars. 2.5 million years since the appearance of the genus Homo, and 200,000 years only for the modern anatomical man. But the evolution is from inorganic to organic to animal to man and then finally to divine. And this evolution, according to Darwin, is survival of the fittest. According to spiritual people, it is the survival of the fittest to survival of the nicest. And to achieve that, you need to look at 5 human values enunciated in the Sai Organization, which is common to all religions. It is not a monopoly. Sai Organization does not have any monopoly on these values. But we put forward this as a ruling principle in our behavior. Compassion and altruism, equanimity, sacrifice, forbearance, forgiveness, inclusiveness, and oneness. So it makes people think that we actually in the brain are hardwired to be spiritual. And there are some evidence to that. Our reaction to fear and attack and threatening forces is on the limbic system, which is deep in the brain. It's the primitive part of the brain, which the lizard has. We do not want to function at the lizard level. We need to have the primitive brain controlled by the new brain or new cortex, which is the frontal lobe, and those areas which actually get activated when you are meditating, when you are doing altruistic activities, and this has been proven now with functional MRI studies. So anatomical and chemical localization in meditation, compassion, and altruism has been found. There are neurons called mirror neurons which are related to empathic feelings. So the mirror neurons are supposed to be built in to consider the negation of the ego, which is a fundamental
UPSM, healthcare professionals, Australian compatriots, and of course students. Bula Vinaka, Namaste, and Salam Alaikum. And it is an auspicious day because of the... not tall enough, I think. It is an auspicious day because of course, this is the start of Eid al-Fitr as well. Good start. I thank you for your invitation to speak today at this year's Sai conference with the theme NCD Education and Lifestyle, a holistic approach. And I have to say, it's always a pleasure to come up here to Nandi or to the West.
So let's look together to some statistics in Pacific region. As you know, the NCD or non-communicable disease are chronic life-related disease such as heart disease, cancer, stroke, chronic respiratory disease, and diabetes mellitus. Because of the globalization and urbanization, population.
Previous talks as well. Diet and exercise really depends on the mind, and actually the Swami's teaching is main thing which actually helped me to develop this. I think we need those type of higher teaching to control our mind, to how to do the regular control our senses so that we don't eat the sweets which we shouldn't eat, and also the exercise to become part of our family. Just a lifestyle, not only lifestyle, it's become just like eating or drinking or even prayers, that you should have to do the exercise daily. So I think that's the main message. So the topic, I'm going to just give some introduction, then just to show that how the eye works, and that relation of diabetic to eye disease and types of diabetic retinopathies, how to avoid eye disease and eye health and nutrition, eye health and exercise, and this part of a sun damage is a general preventive measure. So, as you know, the diabetes can cause macrovascular, it can cause large and medium-sized vessels to be affected, but it can also cause the capillaries, that's the microvascular disease. And eye problem is part of the microvascular disease, that is the capillaries are affected. And the other things would be nephropathy and neuropathy, which are microvascular, right? Macrovascular is stroke and cardiovascular diseases. Like a camera, and the object is focused by this cornea and the lens, focus the image on the retina. The retina is the film in the back of the eye. So the central part of the retina is called the macula. That is the part which helps in seeing the fine details. That is when you see an object or read, that is the part mainly involved. That's the macula. And the rest of the periphery of the retina, that's the most part involved in the peripheral vision. That is the side vision. So what are the symptoms of diabetes? These are the complications which I have listed here. Diabetic retinopathy. And sometimes eye disease may be the initial presentation of patient being diagnosed with diabetes. Like a couple of weeks ago, I saw a patient who came with just intermittent blurred vision, especially they can't see intermittently, maybe blurred for some days and then it improves. That's because the blood, when their blood sugar fluctuates, the fluid osmosis due to the changes in the lens, they fluctuate the refraction of the eye. So that may be the early signs. This is glaucoma is mostly a late feature of diabetes. Sometimes again I saw another lady who came recently, who was previously well. She just came with, she saw double when you see it to the side. So she presented with first time. So when she sees to the side is the lateral rectus. There are 6 muscles in the eye. The muscle which moves the eye to the right or left. The lateral aspect is the lateral rectus. That muscle was involved, which is supplied by the 6th cranial nerve. So that was the initial symptom. So when we checked the blood sugar, her blood sugar was elevated. So sometimes, and cataract, again, I see a lot of cataract patients which are common in old age, when they are more than 60 years. But when you are diabetic, you can get cataracts when you are 30. So if a patient presents with early cataract, blood sugar needs to be checked because he didn't know that he had diabetes. So these are some of the early symptoms patient can present due to these complications, even they may not have known that they had diabetes. So here, this shows that the eyeball is supplied, there are 6 muscles which moves the eyeball to different sides, and those muscles are supplied with small blood vessels, and they can involve with this diabetes and cause a small stroke and affect the muscles, and they can come with double vision. As you know, eye is so closely related to the brain. It's like a projection of the brain, and some people call it the window of the soul. So as I told you, cataract, when they present with this blurred vision because the cataract reflects the light into different direction. And what we do is we remove the cataract and replace it with an artificial lens. And this lens is, nowadays we use this lens called a blue blocking yellow lens, because the blue light seems to be damaging the back of the eye. So this lens also helps with protecting the macula. Other thing which I told you about the glaucoma, which can be caused by diabetes, because when the blood supply to the eye gets cut off due to diabetes, they form abnormal blood vessels, and the fluid which is inside the eye, which is drained through these small channels here, doesn't drain properly, and because of that, fluid collects in the eye and increases the pressure and damages the optic nerve, and that results in this tunnel vision where they can't see the periphery. Some of the medical students asked me last time why you were selected the topic of ophthalmology and specialization. And this is one of the factors which I selected ophthalmology, because when you examine every day a patient's eye, you are actually able to see the blood vessels in the back of the eye with the ophthalmoscope. That's quite fascinating, because through looking at the blood vessels, you can diagnose so many conditions like diabetes, high blood pressure, or the high cholesterol. All those things are fascinating when you see. So during the camp, we'll be also teaching you how to use the ophthalmoscope, and hopefully you should be also able to see these blood vessels in the back. And also, you can also see the optic nerve in the back, which is actually a projection of the brain. So you can actually see the part of your brain by doing the ophthalmoscope. And so it's a fascinating field where you can see both the blood vessels, and you can see there are so many blood vessels in the eye which get affected by diabetes. So that may be the early sign of diabetes even. So here is a diabetic retinopathy where when the blood vessels affected in the retina, which is called the non-proliferative, that is the early stage of diabetic retinopathy. So if we can pick it up in the early stage, then we could, by controlling the diabetes, blood pressure and cholesterol, we can prevent its progression. Here you get small aneurysms or blood vessels bursting and causing small hemorrhages, or leaking of the cholesterol particles causing hard exudates. Like in proliferative, if you don't treat it at this stage, then they become proliferative stage, where abnormal blood vessels are grown in the optic nerve and elsewhere, which can suddenly bleed. And here you can see, because of the blood in the vitreous, that's the fluid between the lens and the iris, you get this patchy vision or floaters, or even they may lose their vision suddenly. So you don't want to lose them to this level of poor vision, and we could treat them early. Other main cause for the poor vision in diabetes is macular edema. I told you that macula is the central part of the retina, which helps in identifying fine details. And what happens in diabetes is, because these blood vessels here, they leak this fatty material and they collect in the macula, and also the macula gets swollen with fluid, and they lose the central vision and present as they may present with sudden onset of blurred vision. So how can this be prevented? By regular dilated eye examination. We have to make sure their pupils are dilated and examined properly. So otherwise you can miss these conditions in an early stage. If they are type 1 diabetes, they should have an eye examination at diagnosis, and then every 1 to 2 yearly. If they are a child, then 5 years, because in adults we don't know how long they have had the diabetes for. So they have to be seen immediately, and then 1 to 2 yearly. Type 2 at diagnosis, and then 1 to 2 yearly. Suppose if the ophthalmologist detect that they are already started to develop some bleeding, we grade that into mild, moderate, severe, non-proliferative, or then proliferative. If it is mild, we normally see them every yearly, or if it is moderate, then we may see them every 6 months, so that then we can advise the patient and also we can do some laser treatment to prevent leaking of these blood vessels early, to prevent the complications of blindness. What are the preventive measures you can do is the blood sugar monitoring, daily blood sugar monitoring. The control of blood sugars is the main preventive measure once you have diagnosed with diabetes, or if you are prone for diabetes, that is pre-diabetes, if you have family history of diabetes or obesity, then by controlling your blood sugar, definitely you can decrease the chance of developing diabetic retinopathy. As you can see here in this slide, here that this patient was diagnosed with diabetes in 2007. Glycosylated hemoglobin is a blood test which gives blood sugar, average blood sugar during the last 3 to 6 months. So that is the one which I normally ask my patients, how much is their HbA1c is. If it is less than 7, then the chance of developing diabetes is much less, as you can see on the left side here. But if it is more than 9 or more than 7, then the chances are much more. So controlling the blood sugar is one of the important factors. And here you can see that in the blood vessels, where you can, what happens in microscopic level, the green color is the pericytes, and those pericytes cover the blood vessels and they get lost in diabetes. And also there is thickening of the basement membrane of the wall of the capillaries. These result in sluggish blood flow and obliteration of the blood vessels, and because of that the blood vessel wall get damaged and they start leaking this yellow stuff, lipids, and that's what you see here. So this this leaking, the blood vessels get damaged because of the thickening of the basement membrane and loss of pericytes, and the blood, and later on, because the blood supply gets so much cut off, the retina produces a substance called vascular endothelial growth factor, which is called VEGF. And those vascular endothelial growth factors produce these abnormal blood vessels. They are not fully lined, they are very fragile blood vessels. These are the new blood vessels which are formed in proliferative diabetic retinopathy. And these blood vessels bleed and cause a vitreous hemorrhage. So that's why they lose the lose their vision because of the bleeding. So this is the pathogenesis of how diabetes affects the capillaries in the eye, resulting in blindness. One of the main factors, as previous speakers have told us, that when you have diabetes, your blood pressure needs to be tightly controlled. So blood pressure is another independent risk factor when you have diabetes. If that is not controlled, there is more chance that you are going to develop diabetic complication. Suppose if the patient doesn't have diabetes, if the patient doesn't have any kidney problems, then his blood pressure needs to be maintained below 130 on 80, at or below 130 on 80. If they have kidney problem, that is if they have protein in their urine, that's albumin in the urine, proteinuria, then they have to have a lower blood pressure to prevent diabetic complications. So that's very important, that the blood pressure needs to be controlled below 125 and 75, they have kidney problem. So this is just again showing that how blood pressure, hypertension and hyperglycemia cause capillary damage, then capillary non-pure fusion and retinal ischemia, then producing this VEGF factor, vascular endothelial growth factor, and causing bleeding in the eye. So even so many patients I have seen, those who just have retinal hemorrhages, maybe an early sign of they are having hypertension because they haven't had their blood pressure checked. So through examining the eye, we can detect so many diseases. Other factor is the cholesterol, which also again, as previously told, it can also has quite a bad effect on the retina. It can cause inflammatory cascade stimulation and producing abnormal blood vessels. And this high cholesterol also has been implicated in age-related macular degeneration and glaucoma, in addition to diabetes. So now we're coming to the nutrition part. As eye health, nutrition plays an important part on eye health, especially when I was working in India nearly 25 years ago. We get a lot of malnourished premature children with vitamin A deficiency, presenting with their cornea melts. It's called keratomelusis, melting of the cornea, and which requires just the vitamin A replacement. And that really devastating to see a child, a baby which is coming with melting corneas. At the same time, this nutrition, excess nutrition also can be quite bad effect. Like if you take too much vitamin A, then it can cause benign intracranial hypertension. That's excess of fluid in the brain, which causes disc swelling. So anything in nutrition, you should always also be very sensible and know how much to take. These diseases like dry eye and also diet also plays a part in that omega-3 fatty acids have been implicated, which is helpful in dry eye conditions. And cataract, again, free radicals are released due to sunlight, and antioxidants have been found to be useful in glaucoma. But the main disease which has been studied in nutrition is the age-related macular degeneration. They had a very big study in America called with age-related macular degeneration, where you have the macula, you get these deposits called brucins. These are waste products from the rods and crones, which gets accumulated here with age, and they form abnormal blood vessels, and then they bleed, and they causes this sudden blindness. This is one of the commonest causes of blindness in Australia at the moment. So this study, which was done called ARED study, the age-related eye disease study, which was done in America, they found that these ingredients like vitamin C, vitamin A, zinc, omega-3 fatty acid, lutein and zeaxanthin formulation is to be helpful. Especially these two are antioxidants, C and E, and omega-3 fatty acids also promote retinal health. Here I want to show how the age-related macular degeneration develops, because these are the rods and cones, and these are called retinal pigment epithelium. because of the high activity of the rods and cones stimulation due to the light, which is the waste products are produced, which are removed by this retinal pigment epithelium. But with age, when the function of this retinal pigment epithelium decreases, you get this fatty lipofuscin pigments get deposited in the basement membrane. This is called the Brooks membrane of the retinal pigment. Basement membrane is called the Brooks membrane, and this fatty deposits get deposited there, which is called brucins. And below the Brooks membrane, you get these capillaries called choriocapillaries. And there are lot of capillaries below that, and these capillaries produce abnormal blood vessels, grows into the retina and bleeds, and that's how they get this macular degeneration. So, as I said, the diet plays a role, and we have shown how the control of blood sugar is with high fiber diet, low GI diet. And antioxidants also play an important role in cataract and age-related macular degeneration. These antioxidants, how they play is that because of the conversion of energy and diet, you get a lot of free radicals, and the free radicals are neutralized by this antioxidant. They are more found in guava, pepper, kiwi fruit, and also in the nuts and green leafy vegetables. And omega-3 fatty acids again present in nuts and also in almonds, cashew nuts, and also in seafoods like in salmon, herrings, and anchovy. Also, I want to say the water is, instead of drinking fruit juice, the water intake will also help you in diabetic control and dry eyes. Exercise plays an important part. This is just to show this key, where the insulin helps. If you take this key as an insulin for the glucose to get into the cells, when they have exercise, actually plays like an oil to open the lock properly, and also the weight and waist. We have the pot belly and the waist. Central obesity plays an important part in diabetes, the insulin resistance. And because when they have a lot of large waist or pot belly, the insulin resistance is high, and they can prevent the glucose getting into the cells. Smoking, again, this is the main cause of blindness. And the other thing which we found in the camps is a lot of people having damage due to sunlight called pterygium, and wearing protective glasses, wraparound sunglasses which we provide helps in that. So we have now gone through the 3 types of diabetic retinopathies and what are the measures we can take to decrease the blood sugar, and healthy eating and exercise and stop smoking helps.
Quite a bit this morning, and hopefully I'm going to add one more ingredient to the prevention and the education side of things with regards to how we can actually look after dealing with patients who present with diabetes. So the established facts that we have heard repeatedly this morning is that diabetes is a chronic, lifelong condition. What's important to know though is that with diabetes, we also have higher rates of psychological disorders and symptoms compared to the general population. So depression and anxiety are the very common ones. So depression and diabetes, we know that they are found to be twice as high amongst people with diabetes than those without the condition. And an interesting meta-analysis that was carried out about a decade ago actually presented them at elevated levels of 11% to 31%, where we are looking at a normal population of about 12%. So it's equally presented across both type 1 and type 2 diabetes. And it's the chicken and egg question. Does diabetes factor into depression, or does depression lead into diabetes? And you know what? The science, the myth is still out there. They are very interrelated. So, the chicken and egg question, that depression is not only an independent risk factor for the development of type 2 diabetes, but having diabetes increases the risk of developing depression. So we all know that depression in itself is a very disabling condition. But what is more important is the fact that it acts as a barrier to effective diabetes management. So if you're talking about lifestyle risk factors, we know that someone with diabetes is not going to be motivated to get out there and exercise. A lot of our psychological interventions are about drawing this person's motivation levels to actually participate in a more active lifestyle. So with diabetes management, this is a factor that has to be taken into account. So people with diabetes end up with poor adherence to treatment regimens. We know that they present with greater symptom burden and come up with greater complications. And we know typically that in most hospitalizations, we have higher mortality rates when there are NCDs that present along with mental illness. So moving on to anxiety, it's a similar presentation. We find that people with diabetes also have higher levels of anxiety, and now it has both a direct and indirect cause relationship. Well, we know that with the direct relationship, there's a release of stress hormones that definitely affect the blood glucose levels and insulin metabolism. And with indirect stress, we know that with any self-care behaviors, if you're going to be stressed with your own lifestyle, you're not going to factor in doing something positive for yourself. So giving an excuse that you're studying hard or you're working hard, you've got this commitments or that commitments, you're not going to prioritize well-being as part of it. So experiencing psychological stress does lead to impacts on the blood sugar levels. So reactivity to stress, with teenagehood, adulthood, or with the older adult, we have to recognize that it's across the board. But diabetes should be considered as a family disease as well. The role that the family members play in it. I work in aged persons mental health in Australia, and very, very often we have to draw the family in with any type of management with their psychological distress. So it is important to understand that working with people with diabetes doesn't just have to have them in the room. If it's a young child, you're drawing the family in because they are the ones making decisions around diet, lifestyle factors. If you are having a person who's married, you need to draw the spouse in because the spouse holds a lot of what's happening within the home as well. And again, with an older adult, you have to draw the carers in. So family stresses, that's another thing. If we have ongoing stresses, unresolved conflict in the family, you find that this also adds towards a person's well-being. So the two dimensions to consider is really when you draw a person into your interview room and the person presents with any NCD, is to try and identify what's happening in their environment. So whether or not the family is actually promoting wellness behavior, whether the person is being accepted for who he is, and plus minus the medical condition. Many people find that they become demotivated or feel as if they're not doing enough to the family when they are ill. So someone with any sort of chronic disease will find that they're not as functional and not contributing enough. So please try and look at what's happening for them from a psychological perspective. And as I've mentioned with the family control, how important it is to find out exactly who carries the power base, who's in charge of the decision-making process in the family.
Oh, okay. Yeah, very much. Okay. 1, 2, 3. Everyone just follow, okay? 1, 2, 3, 4. Quick. Great.
Okay, so this is called the reggae march. Pretty much you stand, but you march and shake yourself a bit.
Okay. Okay. 1, 2, 3. Stop. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Go on, shake those hips. 2, 1, 2, 1, 2, 1. Okay, we'll change the action. Okay. Next action, Shita.
Anil, come out to the front, please. Quickly, Anil Patel.
Let's go. 1, 2, 1, 2. Lift those hands. 1, 2, 1, 2, 1, 2, 1, 2. Okay. Okay, the hips now. Your hands on your hips. Okay, let's go. 1, 2, 3, start. 1, 2, 1, 2. Shake those hips. Shake it. 1, 2, 1, 2, 1, 2. Okay, that's all. You can sit down. Thank you.
The dental. But,
the totality of my presentation is I can't present here, but anybody who wishes to get hold of an expanded version of it, if they come and see me, I think I'm quite identifiable looking around here. At lunchtime and give me their email address, I can have that sent on to them. And so thank you for the invitation to be speaking here today. Thank you to Ashok, who's been my invaluable guide and has promised to be my disciplinarian as far as making sure I don't fall through this hole in the floor that Rajat's put the fear of the Lord into us about. Now, when I first arrived, Rajat commented on my 1960s tie, and I thought, which is a sort of blunt remark I'm used to from him, but very accurate, very truthful, and very forthright. But in case any of you didn't pick up on the fact that I'm getting on in years, I thought my tie might...
Talks. There was the mention of the word child came 4 times. 3 from Alka and 1 from Martin. And maybe 1 from somebody else, I can't remember anyway. But because these are not very important. Or it used to be. But remember, children are the future. They actually are the future politicians, political policemen, doctors, engineers, everything. But diabetes actually is, it starts affecting children from fetus onwards. I'm sure Rajat will tell you that gestational diabetes is a huge, big problem. And so that's one type of diabetes. The other type is type 1 diabetes, is what children get, where you get the islet cells that secretes insulin is destroyed. And so all children, almost 99% of the children who have diabetes are type 1 and they are insulin dependent. You cannot give them any oral hypoglycemics and get away with. And you know insulin has got to be given by injection. So we are talking about giving injections every day, sometimes 2-3 times a day to children for the rest of their lives. In adults, I don't want to indulge in too much, but I just want to sort of tell you there's something known as syndrome X, which is a trunk of obesity like mine. It grows with age anyway, and mild hypertension and diabetes. But there are lots of, the adults actually have lots of undiagnosed diabetics because they don't present with any symptoms, only when sort of the complications comes, they tend to sort of get diagnosed. But the diabetes might have been there for more than 10 years or whatever. So what about the fetus of a diabetic mother? You get large fetuses, sometimes up to about 10 pounds, and you know that itself has a lot of obstetric complications. Why this happens is because the insulin in the babies are much higher because of the high blood sugar, and that produces something known as insulin-like growth factor 2, and that makes the babies larger. Or it can be small fetus because the placenta gets damaged and you get sort of infarction and you get small fetus. And you get congenital abnormalities in babies like sort of sacral agenesis, they are born with sacrum, absence of sacrum, and sudden death of fetuses occurs, especially in the 3rd trimester of pregnancy. So babies of a diabetic mother, once the baby is born, if they tend to be large, has their own complications, and there's effects of preeclampsia, because preeclampsia is very common in diabetic mothers, and hypoglycemia. After the baby is born, they tend to get hypoglycemic because they have high blood sugar when the baby is in the womb, and so you need more insulin to control, and when the baby comes out, the babies don't know how to sort of shut down the insulin.
This chart was compiled by me and some of my colleagues, and it basically talks about NCD prevention and management. Okay, first of all, we can say is that NCDs are lifestyle diseases, therefore are preventable. Always they are preventable. If you are diabetic, you should have proper sugar control. If you are hypertensive, you should have strict BP control. And while Fiji or in any country, I suppose, the most basic principle anyone should follow is the basic principle of SNAP. SNAP, S for no smoking, N for should have proper nutrition always, A for avoiding alcohol, and P for is basically physical exercise. Physical exercise should be of 30 minutes a day, and that's where Bula 530 comes in. This was introduced by the Ministry of Education and Ministry of Health. Bula 530, where people should be always be engaged in 5 servings of fish to vegetables 5 times a day, and should be having 30 minutes of walk daily. Not generally, you can have a walk such as physical exercises, and also gardening. You can do any type of activities that is essential. And other thing which can have NCDs, which can rather prevent NCDs, is alcohol. Alcohol, people all over the world consume, but only small amount of alcohol is advised. Large consumption can eventually attack the brain. And stress. Stress is another risk factor which is involved in NCDs. So therefore, to prevent or avoid stress, you can have various means. Some of them can be taking a vacation, either by yourself and families. Yoga is very important. It's very essential number one, stress removal number one, and meditation as well. Some of the things which are basically every patient should follow is weight control. Should have physical exercises, patient education. We have some patient education centers in Fiji where patient should be advised on what kind of disease they have. And patient compliance as well. Patient compliance is very important in managing the patient's disease. You should take proper medications at the prescribed dosage. So that's basically explaining the whole of the chapter.
Thank you, Sharma.
Thank you, sir.
Orthopedics. So this is the initial, and it's still on from 1929. That's from John Weber, the man who initially brought up. So it's Weber's classification of ankle fractures. So basically there are 3 types. So here you see the tibia, the fibula, and then the malleolus. So this is the joint that makes up the ankle. So the tibial fibula syndesmosis, that's where they join. So it's basically this level, borderline. In type A, it's below, so that's when the fracture is below the junction. Type B, it's at the junction, in line. And type C is above. So most of the cases is 50% is type B. Causes, it's inversion, so that's when you're walking and you roll like that. And internal rotation, external rotation is when your ankle goes that way. And inversion is when you just go, that's when you're just walking and you just slip this way. And the medial malleolus, that bone is often fractured, so it's this one. Often fractured in type A, maybe torn or dislocated, and there be no widening of this part. But in C, which is the most severe one, it's torn or dislocated. This bone is maybe torn or dislocated, and there is widening. So this space actually enlarges. With respect to stability, this one is more stable. Patients can still walk with this. This one can go either which way, stable or unstable. And type C is unstable. For management, they say ORIF. So ORIF is basically open reduction and internal fixation. So what they do is these patients are placed in a plaster. So they open and then the X-ray, and then they'll manipulate it in such a way. But they won't treat the X-ray; they have to treat the patient. So they'll turn the ankle in such a way that it gives proper healing for the bones to fuse again. And then they internal fixation. So they just do the plaster again.
Well, thank you.
Laka.